Well, this is a common virus that kids can get in the summer. We're talking about
hand, foot, and mouth disease.
Do you ever wake up in the morning and you have blisters and ulcers without warning? Well, probably not, man, unless you're under the age of 10, because this disease usually affects children, not women and men. It's called hand, foot, mouth, and if you weren't careful with human contact, it already went south. Symptoms are there, and if the doctor finds them, he will give you a route of care. If you haven't been hungry, that's a sign. There will also be ulcers, blisters that won't look fine. Fever, rash, and exhaustion, doc will say you should have taken more precaution. The name of the virus is Coxsackievirus A16, and it can be real mean. But the meanest part is there's no treatment, so you'll have to wait for the symptoms to wean. Over-the-counter medication may be the best fixation. You won't even need documentation, but children shouldn't have aspirin, so get your proper education. If your oral cavity hurts, don't go insane. Use mouthwashes or sprays to numb mouth pain. The number of new cases depends on the country. It isn't too high in the States, to say it bluntly. In countries in Asia, the incidence is higher, so when traveling, take care of personal hygiene during and prior.
In Asia, outbreaks are large and occur often. This is definitely not uncommon. Thousands of people may get infected because with close contact, they're all connected. The disease may get severe and require hospitalization, and may even lead to death, aka heart cessation. So stay safe, friends. Try and avoid this hand, foot, mouth epidemic trend. Avoid close personal or fecal contact is what we would recommend. Also for Bernhard to give us an A, if this rhyme he was able to comprehend. So that's it.
That's the end.
hand, foot, mouth disease. It sounds terrifying. What is it?
Coxsackievirus A16 is the most common cause of hand, foot, mouth disease in the United States, but other Coxsackieviruses have been associated with the illness. Coxsackieviruses are unenveloped viruses with linear stranded RNA. Some of the symptoms are fever, rash, tiredness, sore throat, loss of appetite, and ulcers or blisters in the mouth and on the hands and feet. Some of the risk factors are being under the age of 10, particularly under the age of 5. Children in child care centers are at higher risk to be infected with hand, foot, mouth disease. The diagnoses occur by physicians. They usually are diagnosed by blisters and sores found on the hands, feet, and mouth. Body fluids can be tested with a throat swab and/or stool specimen if necessary. There is no specific treatment for hand, foot, mouth disease. However, some things can be done to relieve the symptom, such as taking over-the-counter medications to relieve pain and fever, using mouthwashes or sprays that numb mouth pain. Persons who are concerned about their symptoms should contact their health provider. In most cases, the disease will clear up in a week to 10 days. Hand, foot, mouth disease can be spread by coming in contact with someone that is infected. For example, you might get infected by kissing someone infected or by touching a doorknob that has viruses on it and then touching your eyes, nose, or mouth. Other ways the disease is transmitted is by being in close contact with someone that sneezes or coughs without covering their mouth. The best way to prevent transmission is through frequent hand washing, disinfecting frequently touched and soiled items, and avoiding close contact such as kissing, hugging, and sharing eating utensils.